Today we are talking about dialysis, and in that we will talk about hemodialysis, peritoneal dialysis, the differences and the benefits of each. Hi, I'm Dr. Ajay, Kher, Medical Director, Co-founder and Senior Nephrologist at Epitome Kidney Urology Institute in New Delhi. Dialysis is required when kidney disease and kidney function is less than 10% and the person is having symptoms. Symptoms can be like nausea, vomiting, no appetite or poor appetite, can be swelling, high potassium, or other symptoms related to poor kidney function and accumulation of waste products. Once kidney disease is that advanced and is having symptoms, treatment options include dialysis or transplant. Within dialysis, there are two options: hemodialysis, which is also called blood dialysis, or peritoneal dialysis, which is also called water dialysis. We'll talk a little bit about both of those separately. So hemodialysis or blood dialysis is a dialysis in which blood is taken out of your body, goes through a dialysis machine and is cleaned by the dialysis machine, and then that clean blood is returned to your body. That is blood dialysis or hemodialysis. For this hemodialysis, you need an access which will provide that blood to the machine. So it can be a catheter, a temporary catheter which usually is in the neck, or a permacath, which is a tunneled catheter that goes through the chest into the neck as well. Another option for access is something called a fistula, in which your veins are connected to the artery, and then that vein in the hand, which can be at the wrist or at the arm level, becomes thicker over 2 months, and once that vein is thick enough and has good blood supply, then that vein can be used to put needle in, and that needle will then provide blood to the machine to clean, and then that clean blood is returned through the other needle back to the person. So that is how dialysis is done, or hemodialysis is done. Hemodialysis is something that the person will need 3 times a week and would be 4 hours each. The key thing for people or patients who are on dialysis is to remember that to live well on dialysis, they need to do 3 things. First is to get good dialysis. Second is to have good nutrition. And third is to be active and have good exercise. And they follow in this order only. If you have good dialysis, which means 3 times a week, 4 hours each, and the speed or the blood flow that the dialysis machine is getting should be at least above 300 ml per minute. Once all of those 3 things are achieved, you will get good cleaning on dialysis. Another way to check that you're getting good cleaning on dialysis is to check the urea before dialysis and at the end of dialysis. And the cleaning should be more than 65%, which means if you start with a urea of 100, at the end of dialysis, the urea should be less than 35. Once you've achieved that, that means that you had a good dialysis session which gave you good cleaning. Most dialysis centers will do this test at least once a month to make sure that you're getting good dialysis. In today's day and age, there are a lot of machines that do a calculation of how much cleaning has been achieved as well, which is called a KT/V. And that is something that you can also talk with your dialysis center or your dialysis unit to make sure that every dialysis, they give you a number of KT/V, which usually should be about 1.2 or higher. And that also tells you how much cleaning you have achieved in those 4 hours of dialysis. Once you're doing good dialysis and you're getting good cleaning, then your appetite will come back. Once your appetite comes back, you eat better, your nutrition increases, you will start getting strength. And with that strength, you will be able to increase your activity and get exercise as well. A lot of kidney disease patients, dialysis patients get really weak and malnourished, and it is critically important that they gain that strength and that weight back after they've started dialysis so that they retain and get back their weight and strength. So again, as we talked about dialysis, to summarize, you have the blood dialysis, and good dialysis, good nutrition and good exercise would be key. Another option of dialysis is peritoneal dialysis, which is also called water dialysis. This peritoneal dialysis requires a surgery to put a catheter into the stomach or the abdomen, which will be in the middle of the stomach. Once this catheter is in place, About 2 weeks after this, there is a training that we would do for the patient as well as the family. And after that training, the person does dialysis on their own. This is a simple process but requires continuous steps. Peritoneal dialysis team will train the person on those steps. Once those steps are done, predominantly focusing on cleanliness, then they will get good dialysis which they can do at home. This is a 30-minute process where a clean water bag is standing up on top, and that clean water bag goes into the stomach. It stays in the stomach for 4 hours where the cleaning process happens, and then after 4 hours you connect to an empty bag. The dirty water goes with the waste products into the empty bag, and another clean bag goes into the stomach. So again, cleaning happens. So you need to do this 3 to 4 times in a day. Each is 30 minutes, and that will then be something that will continue for the rest of their life till either they get a transplant or they decide to switch to hemodialysis. Peritoneal dialysis has lots of advantages compared to hemodialysis. It gives freedom and liberty to the patient where they are in control and manage their routine and are not dependent on a dialysis technician or a dialysis center, and they can do this at home. The water bags are provided by the company to the person's home, and so those supplies are at their home, and they can then adjust their schedule as well as adjust their plan based on how their day is running, while continuing to maintain an independent lifestyle. In addition, on peritoneal dialysis, because you're doing dialysis every day, in comparison to hemodialysis where you're doing it 3 times a week, there is a lot of liberty in what you can eat and how you can eat in terms of salt, water, fruits, which are limited on hemodialysis because you're only getting cleaning 3 times a week. So these are differences that are there between peritoneal dialysis and hemodialysis. In terms of outcomes, how long you live, what kind of life you live, majority the outcomes are similar. What kind of life you live, peritoneal dialysis and hemodialysis are significantly different, and it is not that one modality is better. It is one modality may be more suited to a person's lifestyle and type of choices that they have. And so please talk to your nephrologist about both peritoneal dialysis and hemodialysis to decide which one is right for you and how best you can live a life well and full on peritoneal and hemodialysis. I think before I finish, I would like to say people on dialysis can live long lives, between 10 to 30 years also. And the key is to have good dialysis, good nutrition and good exercise, and to be in constant touch and contact with your nephrologist so they can ensure that you're getting the best of dialysis. Thank you.